Ask the Messengers TV show is a TV show that educates, informs, and entertains our viewers on public health issues such as mental illness, suicide, addiction, illness and disease, COVID-19 relief, crime, domestic violence, homelessness, human trafficking, employment opportunities, healthcare, and more. And now, Ask the Messengers.
We all have different abilities, but most people share similar life goals. The Oakland Community Health Network is here to help. Opportunity is waiting. Let's find yours. Hope starts here.
Today on Ask the Messengers, we go one-on-one with Oakland Community Health Network Director Dana Lasenby. Oakland Community Health Network leads a provider service network that assists approximately 23,000 Oakland County citizens at more than 300 service sites across their county. On this episode, you will get to know Ms. Lasenby and more about the resources her organization provides. Ask the Messengers begins now. My name is Tina Nelson, and I am your host today, and I would like to take this moment to welcome Ms. Dana Lasenby to our show. Welcome to the show, Ms. Lasenby.
Thank you. Thank you so much for having me.
I am so delighted. Now, before we find out about the network, let's talk about Ms. Dana Lasenby. Who is she, and what motivates you to get up and do what you do every day?
Wow, I love that question. I love what I do. I am a mother, a wife, and then I'm an advocate. I'll say I'm an advocate. Although my title is CEO and Executive Director, I truly believe I'm a mental health, behavioral health advocate. I actually started in this field in high school in terms of having my first psychology class. And that class, because before that, I wanted to be an attorney, but that class really did open the door to understanding psychology. It made me understand why I asked so many questions about people. I love people. And so this really does give me an opportunity to work in this arena, but also to advocate and help people. And also to really feel like I'm living in my purpose. So as a mother, really teaching my children how to advocate for themselves and what they need and monitor how they're doing. And just in general, and part of the community, being able to help people who may not know about mental health or behavioral health until they need it. So if they need it, being a resource for people in my church, in my neighborhood, and especially here at work, I'm able to put administrative skills together with clinical skills, because my first love really is the clinical work, but being able to use it at this level really to make sure that people have access to services is very critical to me.
You know, I like that word you use, that purpose. Man, isn't it nice when you understand your purpose, know your purpose, and you're working in a field that has so many strong purposes, right? It's multi-purpose.
Absolutely. And it's funny because people often ask me, because like I said, I started as a limited licensed psychologist, and they say, how did you get to be in this seat, in this role? And it's like, that was never my intention, never at all a part of my plan. But obviously there was God that had a different plan for me and what work I needed to do. So I love it. I love being able to be a part of the decision-making, creating programs for people that I know we so desperately need, and really look at the community with a broad lens and look at all the things that impact our mental health, our behavioral health, and even substance use disorder, and why people struggle with addiction.
Well, help us understand the Oakland County Health Network. We're going to use that word purpose. That's our buzzword. I love that word, purpose. So let's talk about the Oakland County Health Network and what is their purpose as it relates to how they do what they need to do for the Oakland County residents.
Well, the thing I think most people don't understand is we are a community mental health. We work with adults and children with intellectual and developmental disabilities, and as well as autism and substance abuse treatment and prevention services. And the way it's best described is we have a core group of providers who provide all of the basic Medicaid covered services. That includes outpatient, ACT programs, which is assertive community treatment, just a full range of mental health and behavioral health services. Then we have a core group of vocational providers who provide day services and really work with people on their employment skills. We also have residential providers. And when I think about residential providers and our vocational providers, one of the critical pieces in that network is to make sure that we have direct care workers. Those individuals who work in that direct care or direct contact arena are really the heroes during the pandemic for us. So those are the individuals who, it's like a school teacher. They're not always rewarded and compensated for the hard work that they do, but they really do keep everything together so that we can serve people and people can remain in their home and remain in the community.
Understanding the network, what you provide, all that information is really good. But before we give them the information on how they can actually connect with you, let's take a quick break right here. And speaking of COVID and all the heroes, we're going to take a break. And when we come back, we are going to talk about COVID and we're going to talk about where we are with it now and the importance of vaccinations. But before we go to that break, tell the viewers how they can connect with the Oakland County Health Network.
Well, actually, we have two important numbers. One is our 24/7 crisis line. That number is 1-800-231-1127. And then our non-emergency line, which is really for accessing services, those individuals who are not experiencing crisis, that number is 248-464-6363. And we have access specialists and customer service specialists available to help people navigate and determine how they can access services.
All right, so we'll be right back. After this quick break, we're going to talk about Oakland County Health Network, how they handle COVID, where we are right now, sort of like post-COVID, and the vaccination situations as it relates to the network and the Oakland County community. This is Tina Nelson with Dana Lasenby. We will be right back.
Choice, inclusion, and full life experience are necessary to promote independence, opportunity, and equality for all people. Oakland Community Health Network is committed to serve as an advocate to protect these basic human rights for our residents with intellectual and developmental disabilities, mental health challenges, and substance use disorders. We promise to listen, respond, and be accountable for managing behavioral health support in Oakland County. Give us a call today. We're here when you need us and ready to respond when you ask.
Would you like to help us save lives? You can do so by partnering with us here at Ask the Messengers by making a donation of any amount. The people in your communities need your support. Help us extend our reach and impact more lives. Supporting our organization is as easy as a click of a button. Just visit our site shown on the screen from your phone or computer where you will see a yellow donation button. Ask the Messengers is waiting on your partnership, and your community is waiting on you.
We are back with Dana Lasenby of the Oakland Community Health Network, and she has been here to talk about a little bit who she is and the buzzword that I love. She said purpose, and that is so important that she is actually living and working in her purpose, and that's a beautiful thing. So now let's fast forward and kind of backtrack a little bit. COVID-19 hit, devastated the whole entire world. How were you all able to make the adjustments, and where are you all now as we quote unquote are coming out of the pandemic?
For us as an organization, we never shut down, absolutely ever, because we couldn't. We are the first responders, and as I said earlier, we are the safety net for the community as it relates to behavioral health care and services. So of course, we know a lot of people try to use the emergency room, and because of the pandemic, they couldn't. So we had to create diversions. We had to create other opportunities for people to access services and support. And very quickly, the state allowed us to go to a telehealth option. And in the past, it was very regulated with a lot of safeguards for security and just privacy and making sure that confidentiality was a huge part of it. But during the pandemic, we were allowed to make phone calls and do things over the telephone, which for many people was critical because people are alone, they were lonely, or they have children who receive services and they needed to continue to receive those services. So a lot of families, a lot of individuals who are not necessarily physically capable of making that transportation really enjoyed the ability to do it through telehealth or telepsychiatry. And so that really, really worked well. There are certain programs that absolutely stopped because of the pandemic and now are picking back up, such as our vocational providers or treatment providers that provide services in the community. With our regular providers, our outpatient treatment providers and caregivers, they continue to provide those services, again, like I said, through telehealth or telepsychiatry. So we try as much as possible not to miss a beat. And we made sure that homes received the PPE they needed, that we hosted vaccination fairs when they were available to the community, and really inviting the people we serve first to those vaccination clinics, and also making sure that their families or their caregivers or the people that work with them on a regular basis have first come, first serve for the vaccinations. So one of the things that was critically important for me and for our organization is that when they opened it up to the community, we knew that we had to do something special for the people we served. So some of those bigger arenas and bigger sites and car rides to the vaccine clinics work well for many people, but some of the people we serve, that is not tolerable for them. So we made sure we set up a clinic that really was adaptable to the needs of the people we serve, and making sure if they needed private or hands-on support as they got a vaccination, that we made ourselves available to do that.
Now that we are somewhat coming out of it, how is the push for vaccination working as it is now? Are more people getting vaccinated, or are they still kind of like teetering on the fence? Have you noticed any changes since, the big push is over?
I think that, those people who actually chose not to get the vaccine and they see so many changes, it's still about education. And I think that once we went to where people were, as opposed to asking people to come to clinics, we went to them. People were more accepting of a recommendation to get the vaccine. I think this original, maybe fear, I should say, with the Johnson shot and the one shot and some of the issues that came up sort of pushed some of that hesitancy again. But we're able to educate people and talk about the benefits of being vaccinated, as well as indicating or demonstrating how it impacts other co-occurring disorders that they may be experiencing. So telling people what's at risk with this, with obesity, with heart disease, with any of these other medical conditions, it puts you at a higher risk. So if you get COVID, you're more likely to be sicker and possibly die. So just really not the fear, not anything like that, just the education and talking about what it can do, and really giving people and answering their questions, and making it as easy as possible that they make the decision. So if we go to a place the first time and they say they decline, they don't want the vaccine, we'll actually plan and go back and ask them again or follow up with a phone call.
Got you. Okay, so we're going to take another quick break here, and when we come back, we're going to have some final words from Dana Lasenby, CEO of Oakland Community Health Network. This is Tina Nelson. We will be right back.
Residents that are experiencing unique life challenges can turn to the Oakland Community Health Network for help and support. Whether it's depression, addiction, or a disability, residents and their families can contact the Oakland Community Health Network Service Access Team. We listen, we respond, and we connect residents to the support they need to overcome life's challenges. Give us a call today. We welcome the opportunity to inspire hope, empower people, and strengthen our community.
Would you like to help us save lives? You can do so by partnering with us here at Ask the Messengers by making a donation of any amount. The people in your communities need your support. Help us extend our reach and impact more lives. Supporting our organization is as easy as a click of a button. Just visit our site shown on the screen from your phone or computer where you will see a yellow donation button. Ask the Messengers is waiting on your partnership, and your community is waiting on you.
We are back with Dana Lasenby, CEO of Oakland Community Health Network. She has been sharing some very valuable information as it relates to her organization. But right now, we're going to get some final words. And Ms. Lasenby, can you just share with us something that you really want to drive home? What is that thing that you really want people to know and understand and be most aware of about what your organization represents?
I think the most important thing for people to really know and understand is that if you're struggling with a mental health condition, with an addiction, or you're struggling with an individual to support an individual with an intellectual or developmental disability, help is available. Reach out to us, and using our phone numbers that are going to be provided, help is available. And I think just to highlight some of the things, I'm so proud of the team we have here and our network of providers, because we do things that, I don't think people really know that we're a part of. So in terms of Oxford, and not to, sensationalize that situation, but our organization was boots on the ground with our providers to make sure that we could support and provide services to that community, and we continue to do so. We also created a program even prior, when we knew children were returning back to school in person. We wanted to make sure that families and teachers and administrators and students had resources. So we created a program called the School Mental Health Navigator. And this is for any school in Oakland County, and it's for any student or family or administrator just to call and get information about how to navigate the mental health system or the behavioral health services that are available to them. So even if they have like I said, a private insurance or commercial insurance, we will help them navigate and help them get the answers so they can be connected to important resources and services. We work with the law enforcement community in terms of providing crisis intervention training for our law enforcement officers. So since we began in 2015, we've trained over 900 police officers or law enforcement officers in Oakland County. We also have a co-responder program that also is sort of like a ride-along with police officers that indicate the individual may be experiencing a mental health crisis. So all of these programs and services are because we are the public entity, and sometimes our public dollars are at risk. So we really want our listeners, people who may see this, to understand how critical those public mental health dollars are and public mental health services or behavioral health services are to this community. Because as a safety net, we're the individuals that help and support the most vulnerable citizens here. And so this is a service not just for individuals who are struggling, but for families and communities. And we work a lot with the faith-based community as well. So if we can get the message out, if nothing else, about how, just call us. We will be there to help you when you need that help.
There you go. Just call. They got you. They got you. They got you.
Yeah.
They got you. Let's say that again. They got you. And Miss Lasenby, she does it with purpose, and she's living in her purpose, and she's making sure that she will provide everything that she possibly can to make sure that the Oakland County residents are well taken care of mentally, physically, behaviorally, whatever it takes. She's got your back. So, Ms. Lasenby, again, thank you so much for being here today. And I know it's such a short time to talk about all the stuff that you do.
We have more.
But, anybody that needs to reach out to the Oakland County resident that needs to reach out to the network, the information is right there on the screen. And you can go to their website, which is right there on the screen, and they will take care of you. And Dana Lasenby just told you, she got you. She does this on purpose. She means what she does. And I believe her. So thank you again for being a guest on our show. And you have an open invitation. So if you need to come back and need to talk about some other things, let's continue this conversation again in the future. Okay?
Absolutely. I appreciate it.
All righty. Take care.
Thank you.
They were supposed to help me feel better after my accident. I only took 2 a day, just like they were prescribed.
The doctor said to stop taking them when I didn't need them anymore.
I didn't realize that I would need them long after the pain went away.
For more information about support and public behavioral health programs, call 248-464-6363 or visit Oakland Community Health Network's website.
Email from school about the incident today.
Scary.
Tell me about it. Did you have any idea that was going on?
None. I mean, you saw Derek at the game last night too. Did you have a clue?
No, but you know, teachers like me, parents, we don't always know as much as you guys do. Kids hear first about what's going on with other kids.
Half the time, it's rumors.
It can be hard to tell sometimes, but if you're ever concerned about a friend who's having trouble with alcohol, prescription drugs, bullying, violence, anything, you need to tell an adult. Mom or me, a teacher, coach, school counselor, someone you know and trust.
Dad, no kid is gonna tell an adult about that kind of stuff.
I get it, but if we don't know, we can't help. Speaking up about a problem, that's what helping a friend is all about.
Well, that concludes this week's episode of Ask the Messengers. We also invite you to follow us on Facebook, Instagram, Twitter, and to subscribe to our YouTube channel. Also, if you would like to support our show, please feel free to make a donation of any amount by visiting our show website, www.askthemessengers.org. If you prefer to mail donations, please make your check or money orders payable to Ask the Messengers TV show and send to 18400 Schaefer Highway, Detroit, Michigan 48235. Ask the Messengers is a program that deals with things that help you. Thank you for watching.